This is very personal for you.
Very personal, very personal.
Tell me about some of your struggles.
Yeah, very personal for me. A lot of the stuff that we're dealing now with police and suicide or anxiety, depression, PTSD is not necessarily solely the result of police work. Police work just kind of enhances it. It's more a concentrated exposure to trauma. So I started being exposed to trauma at an early age, saw a lot of violence as a child, and I saw, I grew up in both, whether it be South America or New York, in the 80s. At the height of the crack, epidemic. So I was exposed to a lot of violence. And when I joined the military, again, the losses that are incurred during service and stuff like that. So I started my police career with a bag of trauma, ready to go. And what we find is, and what I find is that we have people in public safety, whether it be fire, EMS, dispatchers, police, we have a high threshold for exposure to trauma. In other words, we can see a lot more stuff before it really starts to overwhelm us. The problem is our threshold is so high that when we do exceed it, we have that much farther to fall. So that's why you start seeing a significant, it's the difference between the acute and cumulative trauma, but we have both. So you'll have one major incident, whether it be like, 9/11. It's a significant incident by itself. But if you weren't even exposed to that, you have all these little deaths by 1,000 cuts. You see a child hurt, or a coworker is killed in the line of duty, coworker completes suicide. So all these things start to add up over time. And for me, being involved in multiple shootings and the exposure that I had, both working, undercover and working in homicide and all these other, different disciplines within the agency, my last shooting was my threshold, and the wheels kind of fell off. So as a result of all these cumulative exposures to trauma, eventually got to the point where I couldn't deal with it. And I struggled with it, whether it be with substance abuse, self-medicating with alcohol or pharmaceuticals that were prescribed to me, not taking them appropriately. I never felt the ease in which I could go ask for help. Because here I am, I'm, Hispanic cultures, that machismo's there, that you don't cry, you don't do this, you kind of just suck it up and do what you're supposed to do.
And police culture is like
and police, yeah. So I'm really going into another culture that's similar to what I was brought up with, and especially growing up in Brooklyn, you can't be you got to be a little of a tough kid to kind of walk around. So we get a lot of that stuff going on, and it just came to a head. So here I am thinking I'm weak. I'm less of a person. I'm somebody that people used to look up to, and this is all going on in my head. And it got to the point, there's very dark places that we get to when we don't address it. And these could be headed off at the pass. But so mine resulted in significant substance abuse and suicidal ideation. So
you thought about suicide.
So I thought about it for quite some time, and then it got to the point where you don't see the light at the end of the tunnel. There's no hope. And I thought, for me, suicide would be, there's an end to this emotional pain. I suffered a traumatic brain injury years ago that just got diagnosed last year. That just got diagnosed last year. But as a result, and all these things were kind of leading up to it, there's no light at the end of the tunnel for me. I couldn't see. The emotional pain is so significant. And it's funny, I tried to explain to somebody, what depression is like trying to explain what the smell of the color 9 is. It's nonsensical. It's hard to explain. However, I figured I'll just end my life, and it'll be easier. It'll take away the pain that I would rather have every bone in my body broken than have to deal with the emotional pain of depression and anxiety and post-traumatic stress. So shortly within the year of my last shooting, which my shooting actually fell the night before the Virginia Tech massacre. All these things kind of play a little factor. I decided I was just going to take my gun and kill myself. And there's a lot of shame. There's a lot of, I'm letting everybody down. But then in the same breath, you're thinking, well, but I'm not going to be here to experience that. So it's kind of like, well, okay. But then I start thinking about, well, what am I doing to my family? What am I doing to my friends, my coworkers, who've had my back for 20 plus years. And it's, sadly enough, not only did I experience it myself, but last year, I lost my cousin, similar in age to me, to suicide. So it's these weird, kind of surrounded by a lot of this darkness. And
Was your cousin in the business?
No. My cousin wasn't anywhere near. She was in, I guess, finances. But it just, the proximity of the relationship. And I've had several of my friends complete suicide on the department. So it almost seemed okay okay in the sense that not it was okay to do it, but it was an acceptable means because people have already done it. And it kind of made it okay for me in my head. And then over the next couple of years, I would come back from that ledge and I would say, okay, let me try to work on getting better. And then you can't get better. And it was interesting, I told somebody in my last shooting, I'd wish I'd have been shot, and which automatically guarantees you're going to be seeing somebody because it was taken out of context. But I explained to the person, I said, I didn't want to be killed. I said I wanted to be shot. And so one of the doctors asked me, well, what did you mean by that? I said, well, if I got shot, I would have a physical injury that I could see heal. And it would give me some context. Because when you're hurt emotionally and you have the exposure to trauma, it's internal. You can't see yourself healing. And so when you don't see yourself getting better, there's these benchmarks, it becomes an issue. So you try to get better. I'm not seeing it getting any better. And then I come to my second attempt. My last attempt, I received...
3 times.
Yes, 3 times. My last attempt was kind of significant. I received the NAPO Top Cop Award in DC for Police Week, National Top Cop. And I was in the hotel and my girlfriend, now my wife, was there as well, my friends, family. And I figured this is a nice enough hotel where I don't think anybody's gonna come back to it. Excuse me, meaning that, the location's everything. I didn't want to kill myself in, my bathroom or where somebody else would have to clean it up or anything like that. So I didn't want to do it in a familiar place to any of my friends or family. So I figured, here's a good place to do it. My girlfriend's here, my friends are here, my family's here. They can all console each other. So it seemed like the good opportunity to do it. For unknown reasons, I didn't pull the trigger. I took the slack out of the trigger, but I didn't do it. Kind of break down, you cry, you kind of get myself together so I could go down and be with everybody.
I mean, you physically took the gun out
Yeah.
and pointed it at yourself.
Right in my mouth. Take the whole barrel.
And then you took the slack off?
Yeah, you take the slack out of the trigger, and and again, we were carrying Glocks at the time, which for any firearm guys know, there's not
Hair
much.
trigger.
Yeah. And then I don't know why, I don't know what stopped it.
Just in that moment.
In that moment,
I'm not gonna do that.
I would venture to say that the biggest factor that I was dealing with was shame.
Shame that people would
Yeah,
think
absolutely.
less of you.
Oh my God, yeah, absolutely. And shame that I let myself get to this point. We're fixers. We go to police. I go to somebody's house. A 16-year-old is attempting to kill herself because her boyfriend broke up with her. Well, I deal with that all the time. That's easy for me, but when it happens to us, it changes a little bit.
So how did you get better?
It's odd. It's not getting better. I think it's adjusting to the point where we deal with it in healthy ways. Instead of taking a drink, I talk to somebody. Instead of keeping it to myself, I make it a point that, I'm being kind of internal or introspective. Let me start talking to some people. And with what I do now, I help first responders and veterans get services, whether it be counseling, whether it be just peer-to-peer, dealing with somebody who's been in the military or has been a fireman, medic, police officer. It allows them, and me sharing my story and me getting with them, it makes it okay for them to reach out. And I tell them, I said, I'm no more embarrassed of my diagnosis than I would be if I had cancer. I'm just not.
It's just a health issue.
Yeah.
And you can get better from that.
You can absolutely, and you find a new place to get better. Yeah.
What was the impact with the department?
The department really had no idea that I was struggling with anything. And it was really hands-off. I lost multiple friends to suicide from the department, and it seemed very taboo. Nobody wanted to, kind of touch that because it's awkward, it's ugly. So I reached out and I made a plea to my chiefs that I said, we need this, And the plea I made was interesting. We have a bomb squad that has a pretty significant annual budget. And I'd asked them, hey, in the last 20 years, how many bombs have we had? And I think we blew up somebody's backpack, and we found a fake pipe bomb, I think, within that span. But in that same span, we've had, multiple suicides. So I think they understood, yeah, this is a necessity.
Take the amount of money that you spend on a bomb squad that rarely sees duty,
Sure,
and use it to save the lives of officers who are dying at their own hand.
But there's a necessity to have the bomb squad. And I don't want to take away from that, but I think we should make an effort to budget for peer support programs within these agencies. Having successful peer support programs. In other words, like I reached out to the folks over in Boston PD, Sergeant Freary over there, he runs their peer support unit. And then I went out to San Francisco Behavioral Sciences unit, and I said, what are you guys doing? You're the two oldest existing units. And interestingly enough, they gave me everything. They said, here's what we're doing. This is how we're dealing with it. And there was things in there that I didn't recognize were an essential need.
Were you embarrassed by the idea of trying to get help?
Oh, absolutely. Absolutely.
And afraid that your comrades would desert you if you went for help?
Oh, listen, if we're going to be real about it, I mean, I was part of the problem as well. Somebody be like, having a bad reaction to a pretty horrific crime scene. And I'm like, come on, come on. Listen, you're going to see a lot worse. And, I was just adding to it. But that was me internally going, God, yeah, I get this. But you don't want to have that appearance. So again, the stigma is created externally, but a lot of it is internal. Where I reach out now and say, if I asked you for help, would you help me? And hands down, everybody's saying yes.
Do you still get emotional when you think back to those times?
I do get emotional, but not to the degree that it impairs me. I recognize it as for what it was. If I got emotional the same way I did back then, it'd be a really good indicator that I have not really addressed it as well. So I tell my story with the reverence of, hey, this was a dark place, and I can appreciate other folks that are struggling. But I'm the light. I'm them in 2, 3, 4, 5 years.
You can survive this.
You can. It's absolutely.
You can get through this and you can heal.
Yeah, and the reason why it's so frustrating is because it's a preventable thing. I mean, you give the resources. My biggest fear is it becomes, it's the catchphrase right now: PTSD, anxiety, depression, suicide. It's that because we're losing so many officers. But unfortunately, the upper echelon or the management of most agencies, it's starting to become a box that needs to be checked and not a program that needs to be nurtured and both supported emotionally, but more importantly, and this is where it counts, financially.
How optimistic are you?
For me, it's like looking at a sunrise or a sunset, as opposed to you coming out before and after the sunrise or the sunset. For me, there's this gradual change, and we see it. For me, it feels very slow, but we are going in the right direction. And if we shame people into making these programs, I don't care how we get them. I just want these programs to exist, and I want officers, firemen, all first responders to reach out and be comfortable reaching out. No different than if when I tried to take the door down, I broke my hand. Hey, well, let's go take that get that looked at, as opposed to going to a very violent scene or at a loss of, at a funeral or something. Hey, you've been exposed to some stuff. Why don't you get it checked out?
Can you tell me about this shooting that really put you over the edge?
Sure. April 15, 2016, right before Virginia Tech shooting. My shooting's a little bit different. The national average of a duration of a shooting is about 3 to 7 seconds. My shooting took place in a small, bodega, gas station type of convenience store, and it lasted over 15 minutes. So it was a prolonged gun battle, where unfortunately I had to take somebody's life who was in the middle of robbing the convenience store. Growing up in a somewhat of a religious background, the idea of taking someone's life did not sit well with me at all. And a lot of people were confused as to why I was so taken aback that I had to. They're like, he tried to kill you. He was shooting at you. I said, but that's a son. That's, that may be a father. It's a cousin, somebody. It's a person. Albeit, they went sideways. The duration of it being the end of multiple shootings, just collapsed on top of me.
What else do you want to tell us?
I guess my big thing, the big takeaway for me is that The focus needs on getting better, and everybody wants to know, well, how do we do that? And it's simple. Quality education on this topic, knowing what's out there. Everybody wants to help, and they have the willingness to do it, but they don't know how to do it. So I would ask that the chiefs mandatory that people educate themselves on insurance. What coverages are there? You know, if I eventually do ask for help, what's available to me? You know, and all the resources. There's a really good resource that I was fortunate to be a part of called the Vicarious Trauma Toolkit, which is available online through, I was a law enforcement fellow through IACP and with Northeastern University and, you know, the Boston Area Rape Crisis Center, a bunch of IAFC and all that good stuff. And it's resources, tools, policies, procedures, support websites, podcast, all these things in one spot. And it's a free toolkit.